Welcome to our think tank and welcome to the Science Center. When we talk about AI in healthcare, the real question isn't, can it do something impressive? It's really, can it do something meaningful in the moments that matter most? And so it sent me on this path to explore how do you bridge things that are in that messy, complex space after invention. When it comes to the front lines of care, there's one thread that runs through every setting, every patient journey, and every system touch point, and that is nurses. They're not just part of the delivery system, they are the infrastructure. So today's conversation is about what it takes to design the systems that work with, not around, the people who hold care together.
You can't start early enough thinking about who is going to care about the innovations that you're going to build. Whenever I embark on a project, or what I recommend our program managers as they're starting to build their programs, is talk to 100 disparate people in the space that you're building in. Understand the nursing perspective, the venture perspective, the reimbursement perspective. And it's really only once you synthesize all of the different perspectives that you really start to understand what it really takes to innovate in a particular space.
When you're building a product or a new business idea, bringing those users in early and then ensuring that actually the problem that you're solving is the material problem for them and not something incremental. I think it's a really interesting space when you're thinking about bringing AI products to nurses to really win their trust, because at the end of the day, they're actually that last mile and the buck stops with them and they're checking everything. If you give them something and it's not really working, you really have to think about what is your adoption strategy. Do you partner with the health system? Do you get a small cohort? Do they work with you almost like a little project? Do you gamify it? How much of it can you put like in app? All of these things are really important because you're competing for a slice of that nurse's time when the nurse is very focused on 4, 5, 6 patients in a shift.
Oftentimes, nurses don't have the seat at the table within hospitals and health systems that they ought to have. So there's some cultural things, I think, going on that put nurses in a position where it can be really difficult to advocate for solutions that make their lives better, yet they're the number one driver of things like patient satisfaction and outcomes, right? So I think there's a real, shift that needs to happen in the cultural zeitgeist, so to speak, around valuing nurses.
If you go back and look at the patient room, right, think about it, it is ripe for innovation. We're still pushing around carts in a hallway with a monitor and a keyboard. Think about that, right? You wouldn't do that in your own house. Think of how many times patients call and say, my room's too hot, the TV's not working, or things like that are not related to their medical condition. The hospital's not going to buy something unless it has value. Or efficiencies and economics. It's how are you making more money with the same amount of staff? How are you making more money with the same operating room and overhead? How are you doing more procedures with the same amount of capital? Because you already have the invested. How can you have throughput to gain more revenue?
I think the key is focusing on innovations and solutions that are going to allow nurses to work at the top of their license, reduce their mental load, and reduce their documentation load. I think the challenge is getting health system C-suites and others to believe that and understand the ROI there and the value and invest in it. I mean, that's the first step. You can't implement or see outcomes if you can't get started from the beginning.
Thank you so much for coming and sharing your insights and expertise with us.
Thanks for having us.